Spring is in the air, which means the weather is warming up, flowers are blooming, and sneezing and itchy eyes are happening. Does your child seem to have a constant runny nose? Are they frequently rubbing their eyes or nose? Do you feel like they have a never-ending cold? All of these things could point to seasonal allergies or allergic rhinitis, which this video will cover. I'll discuss the causes of seasonal allergies, their symptoms, common ages we see this, and options on how to manage them. At the end of the video, I'll go over when seeing an allergist is a good next step, so make sure you stick around. I'm Dr. Mona, a board-certified pediatrician and mom, and I help empower parents with easy-to-understand, evidence-based information so you can make the best choices for your children. Make sure to like this video and subscribe here to PedsDocTalk TV to stay up to date on the latest videos and new content. Seasonal allergies are caused by an immune system reacting to allergens in our environment. The body's immune system works to detect harmful germs and foreign substances and stop them from entering the body and causing damage. When an allergy develops, let's say to pollen, the body has typically been exposed to pollen multiple times and has marked it as a dangerous substance. It then creates something called IgE antibodies that bind to mast cells, primes them, and readies them to react if exposed to pollen again. If those cells come into contact with pollen again, they release histamine that causes inflammation and leaky blood vessels, leading to the swelling, puffiness, and redness we see in allergies. Mast cells line the nose, eyes, and lungs, so when histamine is released, symptoms typically occur in these areas, which are the symptoms of seasonal allergies. The most common symptoms of seasonal allergies are a runny nose, sneezing, nasal itching, postnasal drip, throat scratching or irritation, and a cough. The runny nose is clear and almost watery and drippy. Children experiencing allergic rhinitis may also experience allergic conjunctivitis, where the allergies affect the eyes. This can result in that red, watery, itchy eyes you can see with seasonal allergies. Many times, children can have viruses with allergy symptoms. But with allergies, there is typically a longer, persistent runny nose with symptoms described and usually has more itchiness than a virus. Children who are too young to blow their nose or prefer not to may snort, sniff, or clear their throats frequently in attempts to clear their congestion. Some kids will do the allergic salute, a term for constantly rubbing the nose in an upward fashion, which can sometimes result in a crease on the nose. Some kids may also develop allergic shiners. Allergic shiners are dark circles that appear under the eyes due to sinus blockage caused by allergies. For those with significant allergies, congestion may block their nose, resulting in mouth breathing, snoring, or sleep disturbances at night. Symptoms can be disruptive and bothersome to children and result in fatigue or trouble focusing at school. Some children will only show symptoms in certain seasons, such as spring, when certain plants or trees are in bloom. Other children can be allergic to environmental allergens that are around the whole year, such as dust mites, and therefore can have symptoms persist through every season. Some of the most common allergens include pollen, mold, pet dander, dust mites, cockroaches, and grass. 10 to 30% of children are affected by seasonal allergies, which is a pretty large portion of the population. It is important to note that it typically takes a few years of allergen exposure for an allergy to develop. Remember what I mentioned in allergies. The body gets exposed to a potential allergen, realizes they don't like it and looks at it as a threat, and creates an immune response for the next time. Hence, this can take 1 to 2 allergy seasons to see seasonal allergies. Therefore, it's very, very, very rare for children under the age of 2 to have environmental allergens. Most commonly, allergies start to develop around age 3 to 6, but they can present in older children and adults as well, especially if they're exposed to new allergens. This is commonly seen when a child moves to a new area that has different trees, grasses, or plants in bloom. They're there for a year or two and then can develop allergies. Sometimes kids will outgrow allergies as they get older, but they can persist into adulthood. And I'm curious if any of you have seasonal allergies. Certain things can increase one's risk of developing seasonal allergies. The biggest risk is a personal history of asthma, eczema, or food allergies. Allergic rhinitis, asthma, and eczema are commonly called the atopic triad because all three conditions can commonly occur together. In all three conditions, the immune system overreacts to certain triggers or substances. It's believed genetics play a role in these conditions as well, and there's often a strong family history of seasonal allergies. But I do see children who have no family history of seasonal allergies and still develop them. So of course, more information and research is needed on risk factors and why certain people are more prone to seasonal allergy. Exposure to smoke and exposure to high levels of pollutants can also increase the risk of developing allergic rhinitis. If you suspect your child has seasonal allergies, there are a few ways to manage them. One is to minimize exposure. It's helpful to look at times when their allergy symptoms are flared. For example, if you note your child is always sneezy and congested when outside, there must be something in bloom that they are allergic to. If that's the case, you can minimize symptoms by having them change their clothes when they come inside and wash their hands well, or take a bath or shower to prevent the allergens from staying on their skin. Keeping windows and doors closed at home and in the car can be helpful as well. Some non-medicated strategies also include nasal saline rinses to rinse the nasal passages of those irritating allergens. If it seems symptoms are present indoors as well, make sure to minimize indoor allergens. Keep the house well dusted, vacuum frequently, and wash pillows and sheets regularly. If available, a dehumidifier or portable HEPA air purifier can also help. Remember that humidifiers and allergy symptoms actually do not always mix, so we want to purify or dehumidify the air when there's allergies present. In terms of medication, the first line recommendation for seasonal allergies is a nasal steroid spray during the allergy season. Medicines like Flonase, Nasacort, or Rhinocort can be given for kids 2 and over. The second way to manage allergies with medications is by adding on antihistamines. Antihistamines are the mainstay treatment for allergies. They work by blocking histamine receptors on cells, preventing the inflammation and allergy symptoms that I mentioned. I usually recommend nasal steroid sprays first for 1 week, and if there is no improvement, adding on a daily antihistamine, usually in the evening. If you know your child gets seasonal allergies every March, starting the nasal spray 10 to 14 days prior to the typical season can also help to reduce flares before the season begins. Over-the-counter antihistamine options include Zyrtec or cetirizine, Xyzal or levocetirizine, which is similar to the active ingredient in Zyrtec, Claritin or loratadine, Allegra or fexofenadine. These are all listed in order of most likely to cause drowsiness to least, but efficacy can really depend on child to child. For example, sometimes we may start with Zyrtec, which is my preferred, and it's not working, but Claritin works better. Antihistamines are typically given once a day at bedtime or in the morning depending on symptoms. There are subtle differences between these antihistamines, so it's good to talk to your child's clinician to discuss if one is a good fit for your child. Benadryl used to be very popular for allergies, but for almost a decade, it's fallen out of favor as the first line since it's sedating for kids and the alternatives are just as effective, if not more effective. Zyrtec is usually my first line recommendation, but it can also occasionally make some children feel sleepy. It works within 1 hour. Allegra is least sedating, but it's slightly less effective, so it's usually given twice a day. Claritin is less sedating than Zyrtec, but it takes longer to work, about 3 hours. In general, antihistamines can also rarely have the opposite effect and make kids overstimulated or restless. So I typically recommend first giving the medication when you're at home and can monitor for side effects. Interestingly, this was most noted with Benadryl, which is another reason why we don't recommend Benadryl as much anymore. Most of these medications come in liquid or pill form, and some have chewable tablets as well. They are all FDA approved to be used for allergy symptoms in children 2 years and older, and sometimes even younger, and dosing is listed on their labels based on age. If your child has allergic conjunctivitis, which is allergies affecting the eyes, check out my YouTube video on conjunctivitis or pink eye for how to tell the difference between allergies from viral or bacterial pink eye. If your child is over 2 years of age and just has the eye involvement of seasonal allergies, your clinician may recommend antihistamine eye drops such as Zatador, Pataday, or Lasticaft. Cold compresses on the eye can also help soothe that irritation, reduce rubbing, which can exacerbate that inflammatory cascade and the desire to scratch more and more. If allergies only involves the eyes and symptoms do not improve, we may recommend adding a nasal spray and or an oral antihistamine for relief or to see a specialist. It's best to see an allergist if symptoms persist despite consistent use of over-the-counter medications and conservative strategies to minimize exposure. It may also be worth seeing an allergist if you can't identify what is triggering the symptoms or your child is experiencing year-round environmental allergies. Some individuals would prefer to avoid allergens than take medications, and if that's the case, it's important to know what your allergens are. If symptoms cannot be controlled with over-the-counter medications, allergists will sometimes prescribe alternative treatments. They may also recommend immunotherapy, which is the regular administration of small doses of an allergen to an individual. It is typically given by a subcutaneous injection which goes underneath the skin, but sometimes can be given as tablets dissolved under the tongue. These regular small doses of allergens help the immune system be less sensitive to the substances, resulting in less of an allergic response in the future. Otherwise, as long as symptoms are well controlled with either medication or avoidance of triggers, it's unnecessary to see an allergist because it would not change the plan of care. There you have it. I hope this video helped you understand the cause of seasonal allergies, the ages it presents, how it presents, and ways to treat them at home with conservative measures or medications. Please leave questions or comments below. I'd love to hear if allergies run in your family and what works well for you. If you found this information helpful, please like and share this video and make sure to subscribe to be the first to know about new videos published here on PedsDocTalk TV. I'll see you all next week for another video. Stay well.